Greetings everyone, and thank you for joining the Long Beach Unified School District COVID Roundtable discussion. I'm Justin Grayson, Chief of Communications, and I'm here with our esteemed staff members, Superintendent Dr. Jill Baker, our Deputy Superintendent Dr. Tiffany Brown, and our Assistant Superintendent of Human Resource Services, David Zaid. I want to kick us off with the Superintendent giving us a few words just of encouragement and a few words about where we've come from and where we're going when it comes to COVID-19. Dr. Baker?
Sure, thanks Justin. I'm really glad for the opportunity for us to talk today in a more informal setting and to answer some of the questions that our community members have asked, both the easier questions and some of the harder questions. You know, the last 18 months has been really, really hard for our community, and one thing that I can say is our parents, our stakeholders have just been absolutely supportive of their children and of the health and safety protocols that we had put in place. With that, oftentimes, as you shared, there's confusion or there's misinformation, and today's a really great opportunity for us to do some clarifying and some sharing with the community. In this really difficult time, I'm also just incredibly thankful to work in the Long Beach Unified School District with the staff that every day are showing up for our students. It was very inspiring to be out in schools over the last few weeks and see our students return to their classrooms, because I'm not shy in saying that the magic happens in our classrooms, and we get to witness every day what our teachers do when they have students in the classroom. And so glad to be here today with my colleagues to answer some questions and also just participate in a way that we hope changes the way that our community members can receive this information.
Thanks a lot, Dr. Baker. So yesterday, all families got a letter from the district. And in that letter, there was a lot of information. That's why we're here. We're here to unpack some of that information and to get more into the details. I want to make a quick reminder though, if you or a family that you know did not receive that information from the district yesterday or any other time, we want to make sure that you go into Parent View and update your information or contact the school to get your information updated. It's very, very important that we have updated contact information for your family so that we can get this most vital information to you. So let's jump in. I want to start off with testing. Last week, Long Beach Unified School District sent out a letter to all families saying that we were going to pause testing for a week. And we said that we were going to, quote, further analyze the data and work with local health authorities to refine our testing strategy. Dr. Brown, what significant data did we find? And also, what are the changes in testing protocol that came out of those findings?
Thank you. I appreciate the question, and I'll actually start my answer prior to last week. So going back to the end of August, we made the decision in consultation with our local health department and with guidance from California Department of Public Health that we would asymptomatically screen students who were returning back to school. We were at a high rate of community transmission at the time, and admittedly, we felt that we haven't had 68,000 students in school altogether with 10,000 staff members in about a year and a half. So we wanted to be very cautious in how we were approaching the reopening of school. At the time that we did that, we committed to do a 3-week testing period, and we did that because we really wanted to look at the data that we gathered and make sure that we were testing enough and that we had enough information to inform our next steps. And in the 3-week period, we learned a lot. We gave over 66,000 tests during that time. And with all those tests, we were below a 1% positivity rate. And that's something that's really, really important. It shows that the other preventative measures that we were taking in classrooms and campuses with support of our community were supportive of having the number of people back together that returned back together. The other thing that was important during that time was through close contacts, we had to quarantine a lot of students. And we had to quarantine students because they were exposed, but we learned that in those quarantines, students were not becoming ill. And so we recognized that we needed to make a shift. We needed to reduce the amount of testing that we were doing, and we needed to create a path for students to have more access to instruction, even in the circumstance of having been exposed.
You know, I thought it was interesting also that once testing started, the data was actually really stable. What we found was that from the first 50 tests to 60,000 tests, the data was very stable. I don't know if you want to add anything to that.
No, Dr. Baker's right. It was really interesting to watch the test results come in and truly see that at 50, at 500, 5,000, and 50,000, we hovered around a 1% rate. And that was telling us that we were pulling reliable information and that we could use that information as a sample of our community to move forward.
Great, thank you so much for that. Let's dig a little bit deeper into that. I know in the letter that came out yesterday, what we've referenced is that we're going to be testing about 10% of our student population. Can you dig a little bit deeper into that and maybe explain away any confusion that parents might have about that 10% number?
Sure. No, again, I appreciate the question. The 10% number came through lots of research, lots of conversation with health professionals, and through guidance of our national and state Department of Public Health. Ultimately, the California Department of Public Health doesn't make a recommendation of a percentage of testing pools that should be made. However, the Center for Disease Control does, and what they recommend is a 10% sampling of an unvaccinated student population is enough to continue to monitor and gather baseline data around that population. And so we made the decision to move forward with testing 10% of our unvaccinated students. We did that because we believe that the 10% range allows us to continue to monitor where there may be any issues. And one of the ways that I have learned to think about surveillance testing, which is what we've been doing since the beginning, is it's the type of surveillance that you do when you're watching a large group. So you're watching an audience and you're recognizing, okay, everything's fine. Oh, something's happening over there. Okay, I need to find out more about that. Okay, that circumstance is okay. Now something's happening over here. I need to find out more about that. And so the effort that we've made around surveillance testing is really to continue to monitor when issues are arising. Surveillance testing or asymptomatic screening, we've used both to describe it. It does not prevent the exposure of COVID. There is no point at which you've tested enough students to ensure that there will be no exposure in a circumstance. There's no way to test enough adults to ensure that either. And so when I think about the ways that we're communicating with our community, I want to put out there that the idea of asymptomatic screening is to monitor, to prevent outbreaks, and to mitigate or lessen any exposure as much as possible. But there is never a point at which we have prevented all exposure when we have so many people together.
Absolutely. Thank you for that answer. I want to follow up one more on that. Is the test random? Is there going to be a way that parents are going to know whether their student's going to be tested that week? What about anyone who thinks that their student has been randomly tested or multiple weeks in a row? What can you say about the randomization of the testing?
What I can say is that we are going to be testing 10% of unvaccinated students. And so we have created a process by which we will pull a sample of 10% of unvaccinated students for a school site, and we will test those students week over week. By design, it could potentially be the same student a couple of weeks in a row, but likely it'll be a random group of students week over week. So it shouldn't be the same student every week, but there's potential that it could be. We'll be doing our best to make sure that we are testing a representative group of students in the school, meaning not everyone from the same grade level. We want to spread out the way that we're looking at classrooms and the way that we're looking at the groupings of students that we have together.
I think it's also important to add on that topic that we have a methodology that will be used not by a school site staff, but that a central office team who doesn't know families and isn't involved in the day-to-day function of the school will actually be running that methodology behind the scenes to alleviate that for schools, and also to just, parents should feel comfortable knowing that this is not something that a school team is deciding. It's something behind the scenes that we're able to more closely monitor and do on behalf of our schools.
Yeah, thank you. That makes a lot of sense. One of the questions that we've received from our families here in Long Beach are, why are we only asking unvaccinated students to test for COVID-19? Dr. Brown, is there any insight you can share on that?
Yeah, that's something that there's been a lot of expressed opinion about, and we continue to land on testing unvaccinated students really because it's what the national, state, and local guidance says. The CDC recommends unvaccinated students for asymptomatic screening. The California Department of Public Health does as well. Our Long Beach Health Department has been supportive of the idea of unvaccinated students. And what we know is that there is more vulnerability, more potential for exposure, and more communication of the disease potentially in people that are unvaccinated. But I want to recognize, and I think part of our intent today is say, we know that that has been an issue that has been expressed as a concern for members of our community. And I want to say that we are continuing to do what we're doing with the health guidance that has guided us throughout the pandemic, and in response to what we're seeing the need be within the schools.
Absolutely. So now that we've talked about testing, let's say that my child tests positive, whether it's at school or whether it's at their local pediatrician or at a drive-through testing clinic. What happens at that point? What's the district's recommendation for a parent? What do we do once we get that positive test?
So in the event that that happens, the best thing that the parent can do is notify school. And also notify any group that their child has been with or any people that they have been in close contact with. That's one of those areas where we have a community responsibility to one another. But specific to impact at school, notifying the school that the child has tested positive, where then the school can go on a process of tracing back the last date of exposure, the last time the student was on campus and who they may have been close contacts with. And then for that parent who has a child that's tested positive, they will need to remain home throughout the isolation period that has been directed at the point where they tested positive.
Can I add something too? I mean, that's a sensitive subject for our families to understand, but I think about that this is a community-wide effort. It takes families saying, you know, my student may be experiencing symptoms, and we saw the first several weeks of school, while we would like to have our students at school each and every day, to keep things safe and to follow the protocols, we had many families that, for preventative reasons, and or because their student was experiencing symptoms and ultimately tested positive for COVID, made that hard decision to keep their student home either as a prevention or as a response. And so just want to go back to that, you know, we are all in this together, and it really does take all of us to make decisions that keep the entire school community and our community at large safe.
And I would just add to that by simply sharing, we certainly appreciate informing parents on what they should do if their child tests positive, but the number one thing we need parents to do each day is to monitor their children for symptoms, to ask their children how they're feeling, to look for fever or cough or runny nose or any of the symptoms, and to keep their children at home. And I want to personally thank some of our parents who have already done that, because that is all a part of working as a community to ensure that all of our students are healthy and safe.
I know that's a part of your life too. Yes, you're the father of 3 students Absolutely. In our district, and so 3 times every day you're thinking about those questions and Absolutely. Making sure that your students are going to school healthy.
It's also something that's a confusing message for our community, because for many years we have said school attendance, come to school. If you have a minor cold, it's okay for you to come to school. And we have really emphasized the importance of attendance. Now we've moved into a space together where we're actually asking people to be extremely careful and keep their children home in times that they may have never kept their children home prior. And we acknowledge the change in message, but changing times have called us to ask people, our community, to join us in a different way around keeping children who are ill home, and also for adults in our environment, staying home when you're sick as well.
I think this is a good transition to talk a little bit about quarantine. Students who may have those symptoms have been asked to stay home. Students who test positive are put on a quote-unquote quarantine or isolation. And so If we could, let's jump into what we're calling modified quarantine. In the letter that went out yesterday, there is some information about a modified quarantine. So what is modified quarantine, Dr. Brown, and how is it different from the quarantine procedures that we've used in the past?
I appreciate the chance to talk about this because it's something that has been sought after by our community. So the California Department of Public Health on September 1st, so the day after we started school, allowed for what they call a modified quarantine. And you may have noticed in the news recently, districts are beginning to touch on using this modified quarantine. We made the decision to learn in our 3-week opening of school what our circumstance would be like to have such a large group of students and staff back together. And we moved forward with what had been traditional quarantine, which is 10 days of quarantine after the date of exposure for a student who was a close contact or a staff member who was a close contact. There's also something that's called shortened quarantine, and that is something that some of our families or students have experienced, and that is an opportunity 5 days after an exposure to test for COVID. If you test negative, then after the 7th day, also on the 8th day, you're able to return to the school setting. So to answer your question, with all that background, a modified quarantine allows a student who was exposed to somebody who tested positive for COVID while masked, so both wearing masks, that they are able to continue going to school, and they're able to continue going to school in a couple of circumstances. One, that they continue to be asymptomatic during that time. Two, that they test for COVID twice during that week. And lastly, that they are not able to participate in extracurricular activities. So it's the combination of those things together. The other thing that I should mention that's also a part of the criteria is that they need to continue to mask appropriately. So modified quarantine, you keep coming to school, you wear your mask appropriately, you remain asymptomatic, and you test twice during the week, and you can continue to access instruction.
Yeah, thank you. Dr. Baker, modified quarantine, it sounds like it's a method to keep students learning, right? It sounds like, I know you mentioned earlier that the magic happens in the classroom. Can you just talk a little bit more about that importance of having students in the classroom versus them being at home or being absent from that in-person learning?
Yeah, absolutely. And I'll go back to last year and just thank our teachers who did such a phenomenal job of providing distance learning. The laws around distance learning changed, which required us to really think about independent study as the only other option from coming back to school. But I'm not shy in saying that I think our classrooms are the best places for our students to be. In addition to what we see between the teacher and student, which we know is the #1 factor influencing student achievement, the #2 factor influencing student achievement relates to principals. And what you can extrapolate from that is that schools are places where families get support, where meals are served, where counseling services are provided. We now have social workers and wellness centers and all different kinds of intervention staff that can surround a student who's struggling or a family who's struggling. And so in addition to the instructional aspect of being in a classroom, there's also supports for students and families that are harder, much harder to access when not in person. And so modified quarantine is a way, it's a way of keeping students in school that are not showing symptoms. And in addition, I'd love for Dr. Brown to talk about what our data has shown us about students who have had to quarantine and that we're not seeing students who are staying home under quarantine become sick. In other words, in its simplest form, students are having to stay home who aren't sick and miss days of school.
Yeah, I mean, I think you said it really well, but that has been in our quest to gather 3 weeks of data. We wanted to know what our positivity rate would look like, but we also wanted to know what happened with exposure, right? If you were exposed, we're sorry that happened. Did you become ill? And what we found in the large group of students who had to experience a quarantine during the first few weeks of school is that many of those students did not become ill. And what that tells us is that we have a responsible amount of information to cause us to say, let's create a path for students to be in school, participating in school, and with all the benefit that Dr. Baker just described. I also want to, because part of our effort here today is to just be very transparent and to try to talk about some of the things that have been challenging and that we've been really challenged on. So I know there are parents listening right now saying, why did you do that? Why didn't you do that on September 1st? Why did my child have to go through this experience? And the answer to that question is a couple of things that are important for our whole community. One is the guidance came out very late. It came out late enough that we had already communicated to our whole community and our staff what would happen if someone was exposed. If someone was exposed, they would remain home. So that's an important detail that we felt like we couldn't just flip the switch on. The other thing is we really wanted to have that 3-week period of information, and we wanted to give opportunity to communicate the information that we learned in that time in a way that allows people to really take in the information. Because for every family who may be thinking, my child had to quarantine and I wish that hadn't happened or that didn't need to happen, we have many families who feel like, I still want it to happen because I'm concerned about exposure. And that option of quarantine won't go away for any family that wants to continue to do a full quarantine, but we will allow for those who have been exposed to do what we're describing as the modified quarantine.
You know, as you share too, it just reminds me of our responsibility as a district to think about the entire student population who we serve. And sometimes from an individual family perspective, the decision does not feel like the right decision. But I think it's important for our community to remember that we have responsibility for 69,000 students, and we're thinking of all of them in the systems and the decisions that we're making.
Yeah, I just want to share, picking up on what Dr. Brown shared as well, that what's nice, and one of the reasons why I really appreciated the opportunity to pause and to review the data and to establish systems, is now in the event that a student became positive and we identified those close contacts. And just as a reminder to our families, those close contacts would mean less than 6 feet for more than 15 minutes cumulative. And so what's nice is now we've modified our exposure letters. And so our exposure letters that will go out to families will give them those 3 options. The one option of quarantining for the full 10 days and remaining at home. The second option of the shortened quarantine, which allows them to test on day 5 and return at after day 7 or on day 8. And then the modified quarantine, which keeps them in school. And so it's nice that our families will have the opportunity to receive that in written communication and make a decision on what's best for their child.
Great, great. Thank you all so much for those answers. You know, the one thing we know for sure through science is that vaccination is the leading form of prevention of any sickness or death from COVID. What kind of progress has the district made when it comes to vaccinating students and staff?
Sure. So, I mean, I can kick us off, and just thankful that, first of all, that our community has been a community that has embraced vaccination. We have a partner in our city that has prioritized educators and prioritized children in there over the last year. We estimate that about 80% of our staff are fully vaccinated, which is a little bit above actually the city and above the state average. So it tells you about the commitment to health and safety. And I guess what I'd want to say, and then I'll pass to my colleagues, is as a vaccinated person, it still means that I have to follow health and safety protocols and that I'm still committed to all of those things. And I think that to the question about why are you only screening unvaccinated, Dr. Brown described that is where the most risk is for people. But even as a vaccinated person, it is important that we are all following the health and safety protocols and making that commitment and encouraging our neighbors and friends and colleagues, if they have not yet been vaccinated, to make that choice for themselves.
Has Long Beach Unified considered a similar mandate, a vaccine mandate like Los Angeles Unified did?
Sure, and I've actually, thanks for asking that question. I've been asked that a number of times since LA Unified's announcement. We see that decision around children to be the California Department of Public Health's decision. Their purview is around student vaccinations. And so while that sounds like it, for some people, they want us to make that mandate, really feel like that needs to be left up to the health officials in our community and those that connect the COVID-19 vaccine to the other vaccination program to decide at what age and at what interval. That is really a medically oriented decision that we feel like the California Department of Public Health should make.
Are there any things that we didn't go over today that you three think is important to let the community know?
One of the questions that comes up often is about our COVID-19 dashboard, and I'd love for Mr. Day just to share a little bit, an update on how families and others in the community can read that dashboard.
Absolutely. Our dashboard was created last year to make COVID information transparent to our families, and it shows the exact day that there was a positive, whether it be employee, whether it be a student, or whether it be a vendor on our campuses. And so with our new screening, when we find out that a student or an employee has screened positive, we receive a report, and what that allows us to do is update our dashboard. So our parents and our families can continue to check with our dashboard. You can isolate the report by school site, and that allows you to just see the accurate information, and it continues to track our students, our employees, and vendors.
Thank you so much. Anything else before we wrap?
Yeah, there was a question that's really important that I've been asked in the last several weeks, and it's around, can students be required to asymptomatically screen? And parents have asked specifically about an opt-out. And so I just wanted to specifically address that. We absolutely want everyone who's unvaccinated to asymptomatically screen. It was our intention in doing it, and it's something that we've asked our community to participate in. But because we don't have an alternate educational program as we did in the spring, and community members, parents, and caregivers of our children who were with us last spring will remember that we did asymptomatic screening for elementary students as they returned, and it was required. And we required it because we had a hybrid or virtual option that parents could opt into. We don't have that now. And because we don't have that, we can't require it at the exclusion of attending school. I will continue to say that our best effort together is that we have as much information about any exposure on our campus as we can possibly have. And that will happen through staying home when ill, keeping children home when ill, and participating with us in screening. And if we do that together, then we will all meet the same goal, which is that we want our schools to remain open and we want our students to receive all the benefit that we know comes through in-person instruction. So I wanted to address that because it's been a source of a lot of either joy or frustration, depending on where the person falls in their belief system, which has actually been a part of the last year and a half, is that we continue to work to lead through and for our whole community who have very different perspectives around what is happening, why, how it's impacted them. And our responsibility is to the 68,000 students, the 10,000 staff, and the 100,000+ guardians, parents, caregivers who support the children who come to our schools.
Absolutely. I wanted to just quickly, something just popped into my mind. I know that there's a registration system for students who need to test, and it's called Color. David, can you give a quick little update on what is Color and maybe some encouragement for families to register so that students can be tested?
Sure. So our Color system is the system that we're using to do the asymptomatic screening for our unvaccinated students. It's also the same system that we're using for our staff. And so each school has a separate link, and that can be shared with parents. Most schools have parents fill out a Google form. Once they fill out that Google form, the link is then shared with them, and they can go ahead and register. Once they register, it makes the entire testing system really seamless and smooth. Most students or staff members who need to test are able to do that test, self-administered nasal swab test, in just a few short minutes, normally 2 to 3 minutes. And so if there is a family who is interested or has not signed up just yet, we would want them to reach out to their school to fill out that form to make sure that they have the link and to get registered.
You know, you completed that form as a parent as well. I know that some parents have expressed concern about some of the questions that are asked. Any advice for parents who might be contemplating going into color and having their students part of the unvaccinated student screening, and how they might handle some of those questions?
Yeah, I would say for staff or students, if there is a question that they come across that they don't feel comfortable with, one of the things that I would encourage them to do is to take a look at all of the response options that are there. The color system, the main thing that it needs is your basic information, your name, your email, a way to ensure that you have the results and to make those available to you. But if you do come across a question within the system that you don't feel quite comfortable with, you can select the option that allows you not to respond to that particular question. So I would just encourage our families to fill that out with their students and to respond and to join in the health and safety procedures and protocols that we have in place.
Related to the idea of modified quarantine, I just wanted to come back to 2 quick points as we're talking about testing. One of the things that the modified quarantine requires is, so the student can continue going to school, but one of the requirements is that they test twice weekly. We are fully prepared and wanting to test any student who would benefit from that modified quarantine, provided they are registered with us and that we have their parental consent for us to test them, and we can seamlessly manage that at school. If the parent does not want to register in color or does not want us to test, they will need to manage that on their own, and they'll need to do that with a laboratory test, either a PCR or an antigen test, not a home test. And we'll need to have those results before the child enters school at least twice per week so that they can continue to attend. So that feels like an important piece to mention. And the other thing related to modified quarantine that I want to make clear, because I mentioned it around extracurricular activities. The idea is that a student can continue to attend school, but on the modified quarantine, for those close contacts that were exposed and are unvaccinated, they will not be able to participate in sports. However, they will be able to participate in childcare. And I think that's a really important thing for our community to hear, is that for us, childcare is not an extracurricular activity, right? Childcare is a required component of some of our families' lives, and so that will continue to be available through the modified quarantine.
From what I've heard today, it sounds like, I'm sure we can all attest that your jobs are extremely difficult, but that you take a lot of pride in the work that you do. And as one of the newer members of Long Beach Unified School District, I want to thank you, and I really do see the hard work that you all have put in on a day-to-day basis, you and your staff. You know, it's a hard job getting through this entire pandemic. And I want to really thank the parents, the families, the community for working with us, for asking these tough questions. You know, we don't shy away from these questions. We want to do our best to be transparent and to be open and to just be informative. We've prioritized communications as a district, and we want to get better. So feel free to let us know the things that we can do to get better to communicate to you. If there are no other major things that anyone wants to say before we wrap, I want to thank you three, Dr. Baker, Dr. Brown, and David, Mr. Zaid. Thank you all so much for your just openness and willingness to do this kind of video discussion here. And let's not make it the last time that we do something like this.
Thank you.
Thank you to the community, and that's a wrap.